Welcome. This is Barbara Brandt, Director of the National Center for Interprofessional Practice and Education at the University of Minnesota. Today you are joining a webinar presented by the Health Professions Accreditors Collaborative and the National Center. It's on guidance on developing quality interprofessional education for the health professions. And I want to welcome the people who are joining this webinar. We actually have people from 7 countries outside of the United States. So we're very pleased at the interest in this introductory webinar on the guidance that was released on February 1st. On the webinar today, I will serve as the moderator, and the presenters are Joe Zorick, who is an associate professor at the University of Wisconsin-Madison School of Pharmacy and was a consultant to the National Center on this project. And Dr. Peter Vlasis, who is the executive director of the Accreditation Council for Pharmacy Education and helped to convene the HPAC group, the Health Professions Accreditors Collaborative. So to begin talking about what is this guidance and where did it come from, on your screen you see the historical barriers of interprofessional education and interprofessional collaborative practice. And they're known to many of us who work in the field. Resistance to change, lack of leadership, crowded curricula, cost factors, the silo separation of professional programs, and treating IPE as an add-on rather than integrated into the curriculum. But often what is also brought up is the lack of accreditation IPE expectations. So this is not a new issue. In fact, it was first brought up in the literature in 1997 as a result of the Pew Commission, which was looked at health professions education in the early 90s. And you can see the list of the literature. It came into the IOM's Crossing the Quality Chasm report, the Institute of Medicine's Health Professions Education, A Bridge to Quality, and others. Joe Zorick co-authored a paper that's a seminal paper in 2013 that's often cited about accreditation standards and vision for accreditation and IPE. And Pete has served on an IOM or a National Academy of Medicine study section on accreditation for health professions education. Goes over what I call the trilogy of the IOM reports. It first started with To Err is Human, that talked about poor teamwork leading to increased errors and morbidity and mortality. I mentioned the Crossing the Quality Chasm report, that the need for training in teams, and then new competencies back in 2003, that teamwork was a competency for all health profession students. In Chapter 5, in that Bridge to Quality report, it does also cite accreditation as a leverage point, the need for descriptive versus outcomes-based models, and then extensive collaboration across accreditation organizations is needed. In the IPEC report, which is the core national competencies, and the recommendation in the Bridge to Quality is that Health and Human Services and leading foundations should support a common language and competencies across the health professions. And that was fulfilled by the IPEC collaborative. And also the National Center was brought up to also address these competencies. Next in recommendation was the building upon the accreditation bodies should move forward expeditiously to revise their standards using a core set of competencies and coordinating their efforts. So Pete.
Good afternoon, everyone. This is Pete Vlasis. And so with that introduction about the what the National Academy of Medicine, or the IOM at the time, was recommending, and what IPEC was formed and began to participate in. We, the accreditors, medicine, nursing, and pharmacy, had been meeting independently, just kind of learning about, from, and with each other for a while. But then when we saw what the IPEC was doing and some of their publications, we began to meet together and expanded to the osteopathic group, the public health group, and the dental group. And for about a year, we talked about what could we do as accreditors to advance some of the work the IPEC was doing. And we decided that we would form the Health Professions Accreditors Collaborative in an effort to say that we believe in interprofessional education, and that some of the work that the IPEC was doing was fundamental to programs that the 6 groups accredited. All 6 members here are members of the Association of Specialized and Professional Accreditors. So when the IPEC group grew from the original 6 to, I believe now it's 21, we then had some discussions on the next slide with the Association of Specialized and Professional Accreditors. And this group is 61 accrediting agencies. 2/3 are health related and 1/3 are not. And sometimes some of the things that we would want to talk about at ASPA would not fit into the ASPA agenda. So we, because not all the members would benefit from that. So at that point in time, we reached out to ASPA members who were in the health field and said, come and listen to what we're thinking about, what we're doing, and would you like to join in this collaboration? And as of this year, we are now up at 25 different accreditors who are now HPAC members as well as ASPA members. And the list here is some of the names I think you'll be familiar with. I was pleased when I saw the list of people who are participating in the webinar, that many of my colleagues who are involved in HPAC are on the webinar as participants today. Next slide.
So just a little bit about the National Center. It was founded in 2012. It's a unique public-private partnership between our founding funders, and the list is there. What's important is that this was a peer-reviewed process that was run by the Health Resources and Services Administration, and we have been charged to guide the nation on the use of interprofessional education and collaborative practice. But more importantly, in the HRSA funding opportunity announcement, the National Center is required to be an unbiased, neutral convener and a consultant on matters such as IPE and interprofessional collaborative practice. So this process that we will be describing is an example of that convening and facilitating national conversations.
So we had some discussions at the HPAC when we expanded the membership and said, what could we do together that would help advance the field? And I have known Dr. Brandt for a while. She was on our board of directors when I first got the ACPE. And subsequently, she had asked me to serve on the National Center Clinical Advisory Group. So I was familiar with what the National Center was doing and their work. And I also understood where HPAC wanted to go and invited Dr. Brandt to come to a meeting and discuss how we could work together in some capacity. And we developed these goals as to what a guidance document would possibly do. and it was to really focus on preparing health profession students in the U.S. better for collaborative practice through the fact that we were going to try and work together to uh, put guidance out there on how to do better interprofessional education. We also then said we wanted this to enable academic institutions in the U.S. to develop, implement, and evaluate what they're doing in interprofessional education and how to develop plans that would be overall consistent with what accreditors would be saying would look like quality interprofessional education. So we went through an interesting process. And in April of 2017, this was the meeting where we invited people who wanted to be in HPAC in an expanded membership. And they attended, and we talked about the guidance document. We had, Barbara and Joe there, and we were talking about, the possibilities going forward. We then had a group volunteer to be on the writing team, which I'll explain in a second. We then developed an outline over the next couple of months. We took that outline and vetted it at a national center conversation cafe with a group of stakeholders. In September at the HPAC meeting, we came back, we got the outline, we had a lot of discussion, a lot of input from people, some of whom are on the call or on the webinar, and we really refined the outline. We were commissioned by the writing team was commissioned to go ahead and draft a guidance document. We did that over several months of iterations. We then brought it forth to a meeting in March of that year, and some of the time delays here was the boards and commissions of 24 organizations met at different times of the year, and we wanted to make sure that we were getting consensus approvals with people having adequate time to review and comment. So again, by the April meeting of HPAC, again, we discussed more feedback on the document itself. We got some great feedback that required, redoing some of it. We did it over the summer. We sent it out in June for all the boards again to review and give us final endorsement to have their names on the publication. And it took up until January of this year to have that accomplished. But on February 1st, we were able to release the document publicly, both on our website, the HPAC website, as well as the National Center website. The writing team is on the next slide. So I volunteered, but in addition to that, we had Barbara Brzezinski, who's with the Liaison Committee on Medical Education, Stacy Borowski from the Council on Social Work Education, and Jacqueline Wall from the American Psychological Association Accrediting Group. So we had a nice mixture of accreditors in the healthcare space. And then Joe and Barbara as our collaborators, consultants, and they brought tremendous experience, both personally and from the national centers growth and experience over a 5-year period in understanding what the world of interprofessional education looked like and the opportunities for quality improvement. So the document itself is organized with an executive summary. It is has an introduction about why should we care about interprofessional education and what the issues are. We provided some general guidance where we tried to look at the terminology issues that were out there and how to frame them in a way that would be available to multiple audiences. We also talked about the environment and how varying the environment is uh, for lots of reasons across the country. And again, this document is primarily focused on the U.S. healthcare system, but I would understand that with many colleagues from other countries on the phone, I mean, on the webinar, that that a lot of these principles here that we're describing would have application in any educational system for health professionals. So then we focused and said, who were we writing this document for? Who would benefit from a guidance document of this kind? And one was the leaders of institutions of higher learning, and where a lot of the health professions are based, and are ultimately in charge of the programs. The actual people who are running individual health profession educational programs at a leader level and at the faculty level. But then we also said the information in this document would also be beneficial to our accreditation boards, commissions, and evaluators, so that they would understand more about the reasons for and the nature of quality interprofessional education. Yeah. So let's focus first on the general guidance that we came up with, and it was divided into consensus, terminology, and interprofessional education environment. So the terminology, again, I think, first of all, what was the goal? Well, we wanted, I know that Barbara had mentioned that she had done some consulting around the country, and at one institution, she started talking about IPEC, and people said, what's that? So we understood that there needed to be kind of a baseline where a lot of the information about terminology was brought together, and it was, to guide more uniform expectations for the development, implementation, and evaluation of quality IPE. Definitions from the published literature, we didn't want to make up new ones. We took the best of the best, some of this from the World Health Organization, some of it with the IPEC definitions. And then we also gave perspectives on what did we mean by about, from, and with when we were talking about interprofessional education, and came together on some guidance in that regard. The the other area we wanted to focus on was what was going on in trying to get collaboration and coordination across academic institutions and health systems and community partners, and how difficult that is, but how much it required to be able to do that effectively. It required, and you'll note in this document that we're not talking about accreditation must or shoulds or required. This is for you to be able to do this kind of collaboration. One has to implement longitudinal sequence series of classroom, extracurricular, and clinical learning activities as recommended in other parts of this guidance document. And the endorsing HPAC members recognize the complexities involved and acknowledge that IPE environments vary based on local circumstances. So this is not a one-size-fits-all guidance document. It is with this complexity in mind that the section of the guidance document recognized the importance of creating supportive environments and opportunities for collaboration with the explicit goal of fostering and facilitating the successful implementation of, and this is an important word, coordinated program-specific IPE plans that people get together, they plan together, and they implement together.
So I cannot underscore enough what a historic accomplishment this guidance is. And we had it, as we've described, it was multi-phased, multi-years. During one of the meetings, we worked on the outline together, and we're talking 24 accreditors, and presented the outline, and people could get up and talk about their reactions to the outline. The first outline that we presented, we had the very last section was addressing what institutional leaders should know. During that meeting, one of the accreditors got up and said, this really needs to be the first section. That we, and if you can imagine 25 accreditors and teams going out, we're at many institutions. And so the importance that educating institutional leaders came across loud and clear. So the guidance that we wrote into this document for institutional leaders, again, underscoring that the way they can be leading is to stimulate and or drive the creation of a systematic IPE approach, fostering a collaborative environment and negotiating important relationships for IPE within and, if necessary, outside the institution. So again, that speaks to every environment is different and distinct. So some of the examples that we give in the guidance on institutional IPE commitment is providing strategic direction, providing resources. It may be a dedicated leader and or teams of leaders with sufficient protective time, responsibility, and accountability for IPE at the institutional level. Identifying and developing solutions for institutional policies that may hinder interprofessional collaboration, and formal recognition of faculty effort towards successful implementation of IPE. And again, what I want to underscore is that these are suggestions and examples, and that it is not a must or should, but it is to help stimulate that conversation on campus. So I'm going to turn it over to Joe Zorick, who's been having technical problems coming in. And Joe?
Yes, Barbara, if I can just do a quick sound check. Can you hear me okay?
I can.
Yeah, okay. Well, I think we're good then, and I apologize for the technical issues. I've been asked to talk about the program-specific leaders section. So this section is devoted to deans of colleges and schools, department heads, directors of programs, directors of IPE, and any faculty who are involved or responsible for the development, implementation, and evaluation of IPE for their program. And if, Barbara, you can go to the next slide on framework for IPE plan design. I want to spend a moment to just talk about the key recommendation that comes through in this section of the guidance document. Barbara did a very nice job outlining the institutional leader's responsibility to create a systematic IPE approach, essentially creating an environment that is conducive for IPE by removing barriers or providing incentives. And this section, the development of an IPE plan, is intended to sort of take advantage of that collaborative environment fostered by a systematic IPE approach. And the framework and the idea that sort of we build consensus around within HPAC was that each individual health program would develop its own IPE plan. And the reason for that is that, as stated in the document, this is guidance, these are recommendations, these are suggestions, sort of best practices, but none of this is going to subsume the autonomy or authority of the individual accreditors. So the individual accreditors will maintain their own specific accreditation standards and language, and because of that, what each health program at a specific institution feels like they need to do to meet their individual accreditor standards may be different. But what this guidance document recommends in order to facilitate collaboration is a standardized approach in the development of those specific IPE plans. So what you see on this slide is the framework, and it's the 4 key elements: a rationale articulating a vision and a justification for the plan, outcome-based goals. This, Pete has made mention to the historic work of IPEC. There's an endorsement of the spirit of the IPEC core competencies. Outcomes-based goals sort of would line up with what are the competencies that you and your IPE plan are trying to develop in your individual students. So once those outcome-based goals are identified and defined, then the next part of the plan is a deliberately designed, systematic, sequenced series of IPE learning activities that spans the length of the curriculum. And this is sort of left intentionally vague for reasons I already alluded to, that each individual program may feel like the magnitude of their IPE or the dose, so to speak, how much IPE do we need, that may vary from health program to health program. But each program should be deliberately designing activities in this kind of sequenced manner in order to achieve the outcome-based goals that are defined a priori. Once we have sort of this sequenced series, this longitudinal approach that's integrated into the required curriculum, once we have that defined, the next sort of piece of the IPE plan is the development of an assessment and an evaluation approach. So in other words, if we have clearly articulated goals, we've deliberately designed a sequence of learning activities to achieve those goals, we naturally need to be able to measure whether or not the deliberately designed IPE activities have achieved those goals. So this is a recommendation that there should be an individual assessment of individual learners' outcomes, but then also a larger sort of 30,000-foot view evaluation of the IPE plan to do quality improvement. So, for example, if there's a specific IPE activity targeted towards early learners for a specific interprofessional competency, and the data that's coming back from the evaluation component is showing that it's not achieving those goals, that's a good indicator to do some quality improvement to modify that specific IPE activity. So if we flip to the next slide, Barbara, please. There was a lot of discussion around this process, looking at what types of learning modalities should we be recognizing or recommending. There's a lot of discussion about the value and importance of having students from different health programs learning together. And so this table identifies 2 sort of broad learning modalities of in-person learning, but then also recognizing the importance of collaborative online learning. So for a school or a college that may be a standalone college, there may be opportunities to do quality IPE through collaborative online learning using, for example, mock electronic medical record collaborations, chat room discussions, virtual simulations, for programs that have the benefit of proximity to other multiple health programs where in-person learning can take place, promoting simulations, clinical observations, case discussions, sort of IPE activities that will allow students to get to know one another, to learn about, with, and from one another, as we've sort of endorsed those definitions. So Barbara, if we can, this is the last slide for my section, would be this figure 2, the longitudinal integration of professional and interprofessional competencies. This was a model that sort of shared in the document that sort of highlights the first component of the IPE plan, which is articulating a clear vision and rationale by the use of sort of frameworks and models. And so this figure was created at the University of Wisconsin Madison School of Pharmacy because we were sort of intent on developing an IPE plan that would focus on professional competency development alongside interprofessional competency development, incorporating classroom, extracurricular, and clinical learning experiences that are sort of profession specific, but also simultaneously interprofessional collaborative practice specific. The idea being, within the literature, we sort of honed in on this idea that the concept of dual identity development is key to advancing interprofessional teamwork. And so students developing a sort of core identity of seeing themselves as pharmacists, for example, but also integral members of the healthcare team. This was the sort of framework this was our rationale and our individual model that we created. And sort of we share this in the document as a potential model that could be inspired or inspiring parts of other IPE plans. So with that, I believe I'll hand it off to Pete to go into the next section on accreditation boards, commissions, and evaluators.
Thanks, Joe. Again, the HPAC group included ourselves in people that would benefit from a document like this. And Barbara, the next slide. So we have our boards, our commissions, our site team visitors, our evaluators, and periodically we all review our standards. We knew that a lot of the members of HPAC had IPE standards. Some were in the process of developing them or expanding them or revising them. So this document then becomes an important reference to our members of HPAC, and that hopefully other accreditors who are not in HPAC may still benefit from the document. And we hope that site teams are encouraged to consider the information in the guidance when they're reviewing their own profession standards, policies, procedures, and the desired outcomes. Likewise, we're encouraging our members to consider how the guide would work for their site teams and their decision makers in terms of preparing them about IPE within their respective field, as well as trying to apply it more broadly in the field when they go on site and there's multiple professions involved in IPE activities. I'm going to go fairly quickly here through a couple slides on some of the things that we're getting common questions from. So to give you guidance on the guidance, and how does the guidance document support current IPE accreditation standards? So, and again, Joe said this earlier, it's not intended to replace or subsume individual members' accreditation standards, nor is it intended that accreditors will have identical IPE standards. Rather, everybody maintains their autonomy, the institutions and the accreditors, but they seek to encourage increased communication and collaboration and provide guidance on what is quality IPE. And I think if the guidance is used locally and the accreditors come in, that overall, I think it will be a facilitation of the process and the quality would be the driver. So you already heard from Joe what the guidance document is and the terminology and the definitions and the systematic approach and the framework, and that basically our boards, our accreditation boards and commissions and site teams could utilize this information and to facilitate collaborative efforts across professional programs to advance interprofessional education. Clearly it's that. What is it not? This is not a document that offers mutual accreditation requirements. It is not prescriptive. It contains no must or should expectations. Therefore, the word encourage is used frequently as opposed to required. So how could programs use this document and their parent institutions? So individual accreditation teams will, first of all, individual accreditor site teams will continue to function independently and will visit and review programs as they have in the past. But when each one comes in and asks about the IPE activities for their particular group, then hopefully this would benefit individuals using this on site in developing their programs. HPAC members who endorse the guidance document will continue to communicate and collaborate about IPE implementation. We meet twice a year right now after the ASPA meetings, and we'll continue to share our experiences as the field continues to evolve. Over time, as programs build IPE plans to meet their respective expectations, institutions should expect greater collaboration across programs as these plans begin to articulate with one another. How can institutions use the document to increase the quality of their IPE? It can be becoming educated about IPE. And again, I mentioned that there's tremendous heterogeneity out there in terms of people's understanding of the need, the extent to which their programs have been developed, and this hopefully would drive conversation to enhance and close some of that gap. So then they can also take steps now to increase collaboration and partnerships among programs at an institution, or in some cases to build bridges with other institutions and collaborate. And we see a lot of that going on right now, where a nursing program and a physician program or a pharmacist program at two institutions, but not at any one institution, begin to build bridges for their interprofessional activities. So these are the websites that will get us to the HPAC website, where again, one of the tabs is the guidance document, and the National Center website. And we're now ready to take your questions. Barbara is going to moderate on the next slide. And please type in any question that you would have in the chat box here on the webinar. And we would be happy now to take the rest of the time to answer your questions and see if we have explained this well enough and how you might hope to use this in your respective domains.
So we do have one question. Someone asked if these slides will be available, and we are recording this webinar. It will be uploaded onto nexusipe.org so that you can have access to it, and the slides will be in that in the webinar format. So we do have some questions. And the first one is, are there any standardized established curricula that are already IPE? So Joe, I think I'm going to let you take it first.
Yeah, I think that's an interesting question. Are there standardized IPE curricula? I think my response to that would be no. I think Pete sort of highlighted the heterogeneity that we see, and one of the interesting things that we've learned throughout this process is that oftentimes institutions who, on paper might even seem very similar. Let's say, for example, a Big Ten institution, Wisconsin versus Ohio State, for example. Even though they're both Big Ten institutions, each has its own unique culture. And that culture offers opportunities that are different for IPE at one institution versus the other. And so I would sort of caution against a desire for a standardized IPE approach. I think it's the most impactful IPE plans, these longitudinal plans. They're coming together through strong relationships. And, some of the guidance that made its way into the document some of the best examples of IPE in this manner, they're happening at institutions who already have a systematic IPE approach, and they've been sort of paving the way with profession-specific IPE plans. So that being said, there are some excellent resources that could potentially become standardized. And Barbara, I would throw it back to you to sort of highlight some of the really interesting materials and resources that are available on the National Center's Resource Exchange.
So what Joe is referring to is nexusipe.org has a number of resources. It's a community-generated resource that we do not peer review except for one section on measurement. And the IPEC organization itself has the MedEd portal, and those resources are peer reviewed. But again, between those two resources, there's a lot available. And then there's a number of learning activities, both regionally. The IPEC puts on institutes so that you can learn more about IPE.
The question asked about team steps, and it's not an established curriculum, but it is a component of a curriculum that I think many have tried to incorporate. There's poverty simulation, that is another one that is commonly out there. So yeah, I think you can learn, I think some of the presentations at the IPEC, some of the things you could learn at the summit, there's a lot of things out there, and then you can take that back home and say, well, which of these pieces could fit into a IPE plan for our institution, or how can we modify our plan based on some things we just found out about? So it should be, an ongoing quality improvement. I don't think the perfect IPE plan will ever exist.
So we have another question that's asking about comments on perspectives of regional accreditors on IPE. So SACS, which is the Southern Accreditor for Colleges and Schools, and Middle State. So Pete, you could probably take this, but Joe, I know you have some examples.
So again, HPAC is only specialized in programmatic accreditors. So we have not interacted with the regionals. This is strictly trying to meet the interprofessional education components of the standards, and the endorsement from all these organizations in HPAC is to, again, hopefully help to facilitate. We interact with the regionals at meetings like the CHIA meeting and others, but we haven't had any direct conversations about interprofessional education with the regionals. Are you seeing any reasons why we should?
So the only thing I would add is we have seen SACS regional accreditations where institutions, particularly freestanding academic health centers, have made IPE their what's called QEP. So one of the first was the Medical University of South Carolina. So as far as, working with regionals, we definitely have seen that.
That's great. That's great.
Yeah, Pete, and I would add to that too. I think throughout at least the last 20 years, a lot of the progressive IPE, the best examples of IPE, things that have pushed the field forward, a lot of them have been sort of driven by these regional accrediting organizations and these sort of quality enhancement plans, sort of institution-wide specific plans targeting on one particular thing that the institution is going to focus on and sort of really improve upon. And we've seen, especially throughout the SACS region there, that IPE or interprofessional teamwork has been chosen several times by some prominent institutions, and it has really pushed the envelope and the field forward. So opportunities for collaboration I could see.
So we're getting another series of questions asking about research. And it's a little unclear whether people are asking about research teams as, relative to accreditation. The thing that I would tell you is that we strongly, and I introduced it in the National Center, and Joe talked about it as far as assessment and evaluation is a component of evaluating and researching your particular program and contributing to the literature. We have fine journals in the field, the Journal of Interprofessional Education and Practice, the Journal of Interprofessional Care, but importantly, many of the disciplinary professional journals now are starting to publish interprofessional education and collaborative practice articles. So this is a way to think about career enhancement and scholarship.
So, one of the questions looks like, are research priorities articulated in the document itself? And the answer is we didn't really address what is the primary areas of research that we need. Though I do think assessment of competencies would jump out as, how do we know that people are attaining the competencies that you desire? The other area is how much of this education is leading to changes in collaborative practice. But the document itself did not have a section on what's the research agenda going forward.
Right.
The other question was, is interprofessional include research? In other words, if we're training people to work together interprofessionally, can that training include how do we do research together as opposed to how do we take care of patients together? And the answer is that would certainly be appropriate for any interprofessional plan that an institution would want to put together to have research as a component of the team's capabilities and their competencies. So that would be, an opportunity for an individual institution, and I think it would be well received.
So we have a question about, are there tools to measure the effectiveness of IPE? And yes, this speaks to really the scholarship of IPE. And there is was an IOM study section that was called Measuring the Impact of IPE on Collaborative Practice and Patient Outcomes. And in that document, there is a systematic review of many reviews about the effectiveness of IPE and many suggestions about what needs to be put into place. Also on the National Center website, if you get on the front page, there are like 4 sections. The one that is advancing, underneath that tab, we have 48 tools that have been reviewed by experts, measurement experts, and deemed effective to be using in interprofessional programs. But again, there is not one size fits all. And so these all have to be adapted to individual situations. There was a question, I'll go back, and I'm going to use it as an example. So someone asked, can you speak to how community health workers and collaboration with community-based organizations fits into IPE? This is actually a question that's near and dear to our hearts because we do a tremendous amount of work with underserved populations in the community. And it is in communities, there are many workers and professionals working with patients, working with people and families. This is a perfect opportunity to design interprofessional education in practice, in authentic practice. So there's no question that the whole array of workers and professionals are a part of what we do in authentic practice to design IPE. We have quite a number of questions that have come in. Um, so a question for us, and I might have Joe start with this, is I appreciate that you further articulated about, from, and with each other. Could you say more about how you came to explicate those words? And Joe, again, um, Joe, I'll let you start, and I'll chime in too.
Sure. Yeah, and I think this is a really good question. I think there are a lot of folks in the field have been wondering what does that mean about, from, and with. And I'm actually trying to pull up the document because I don't think we included it in the slide set. But we took a lot of time to think about what does that mean. And one of the key features, or one of the key questions that came up, because a lot of people are talking about sort of trying to move IPE into the clinical learning environment. And what does it mean? Can you do IPE if it's not with just students? Like, does it, quote unquote, count, or would it count if there was meaningful interprofessional education that was taking place between students and practitioners? So an example would be if a pharmacy student was working underneath a nurse or a physician, or if there was a panel of different healthcare professionals, licensed practicing professionals, does that technically count? And so there was a little bit of nuance and adjustment to the expectations around what does that mean, learning about, from, and with. And so who are we learning from? The idea was that we're learning from one another. In most cases, students learning from and with one another, but then sort of a slight broadening of expectations to allow for this idea that there is valuable, meaningful learning that can take place with students and practitioner learning as well. Barbara, do you want to sort of jump in quickly while I pull up the document?
Yes, so there is a body of literature on this topic, and it actually goes all the way back to the 1980s. And Leslie Bainbridge at the University of British Columbia has written extensively about this. So we did look at the literature. We led conversations about what the expectations might be. And there is a body of literature, as Joe mentioned, about needing to be student to student, and that has to do with hierarchy. And so again, there is literature, this is not a new field, that we did consult, and is how we came about to what's in the document.
While we're waiting for Joe, one of the questions here is about gaining support from administrators for IPE and how to do that at the local level. And I think this document is all about educating people about the importance of IPE and the need. In one of the sections where we talk about the leadership, there is a whole series of statements about what the leadership needs to be considering if they're going to support a quality interprofessional education program. And one of the statements I heard, which I really, really liked, and I wish I remembered who did it so that I could give attribution, but somebody talked about, we treat IPE like adding icing on a cake. But the reality is, to really do good interprofessional education and meet the needs of society today, is that we need to rebake the cake. We need another formula. We need another series of ways that we reward faculty. We need another way that we have support in meeting together and getting academic credit for it. We need to have people, clinicians who participate in IPE receive some kind of recognition for that, and in the process change the collaborative practice model. we hope this document, quite frankly, is a catalyst to the conversations that have to take place coming from the perspective of 24 health profession accreditors who have strongly worked together on this document to not be, prescriptive, not be restrictive, but to be a facilitator for the conversations that have to take place so that the resources and the changes in the systems occur. And we hope that, people using the document would give us some feedback overall about whether in fact we're meeting some of those expectations.
So the only thing I would add to that is when accreditors start coming to campus and asking questions, it will get your administrators' attention. We will be doing a lot of education ourselves, but also IPEC has an Institute for Leaders. So it's going to take all of us to educate leaders. I would say for you, the first step, those who are asking this question, and there's several, is to take the document to your curriculum committees, to your department chairs, and really start having that conversation. And again, you are participating with us in the very first webinar and communication about this document. So we really are just at the beginning. I see we have 1 minute to go. And actually there is one very important question about the patient. And yes, the patient is very important. And we can have that conversation about how this is woven into this particular document and others. So again, I am going to thank everyone for joining us. Thank Joe and Pete for being my partners these last 2 years. And we are hoping very much that you continue the journey and send us what would be helpful to you. Thanks.